Hi, I'm Dr. Myrna Lazaga here in San Diego, California. We get a lot of questions regarding dental implants. So today, we're going to answer the most common questions we receive so that you can have a better understanding about the topic of dental implants. Dental implants are like this. It's a small screw that put into your jawbone, and then it represent or replace the root for the tooth that's missing. Usually it's titanium, and it's also biocompatible. Conditions that the dentist would recommend a dental implant is when you have a missing tooth and that we don't want to touch the tooth next to it, but instead we will have an implant so it will be to replace the missing tooth in there. The advantages of dental implant as compared to other procedure like bridge is that we don't have to touch the tooth next to it, and you can floss in there once we get it done. So that way, it will function like a tooth, and then you can have like that missing area replaced without touching the tooth next to it. Let's say, for example, in this case, you have a missing tooth. With the bridge, we have to reduce the tooth next to it and put the bridge into to replace the missing tooth. But in this case, you will not be able to floss in here, and plus you involve the tooth that's beside it. Now, in this case, it's okay if this tooth needs a crown as well. That's, a good way to do a fixed bridge. But if you have a tooth that don't, what we call virgin tooth, that don't even have a filling, and we don't want to touch it, implant is the best solution in this case. The process that you have to go through, of course, is you're going to have an exam and then x-rays, and also we will have to assess the bone that you have, like the density of your bone. And that's very important. So make sure that there is enough bone to support your dental implant. On the dental exam, it involves, of course, to check, if we have enough bone to support the implant. And that also we use special x-rays to determine as well the area where we're going to have the dental implant. Your medical history is important when we're considering implant, because folks that have osteoporosis is not good. That means that their bone density is not conclusive or good bone support for the implant. Your dentist will be able to come up with a treatment plan that's right for you by doing the thorough exam of the involved teeth. Let's say, for example, like I said, when you have two teeth that are already crowned and you lose the one in between, then you can have a fixed bridge. But if there's two teeth beside the one that's missing is untouched or don't have a filling, implant would be the best option for that. The process of or steps in placing dental implants, of course, if the tooth is still there that needs to be taken out, then we have to take the tooth out. Okay, once the tooth is out, there will be time wherein we have to assess if do you need a bone graft, or we can place the implant right away. So those are the stuff that we need to consider. Okay, let's say the normal process would be get the tooth out, place a bone graft, wait for the bone graft to bond to your bone, and then place the implant, and then wait for the implant to heal and bond it to your bone as well. And then after it's all stable, then that's the time we put in the crown. Bone grafting is required when there's not enough bone in there to support the implant. Let's say, for example, the area where you have the tooth that was extracted, we usually place bone graft in there to support the bone that's left so that way it will not shrink. It depends on like if you can have single implant, okay, if there's only one tooth missing. But if you have, let's say you're missing 3 teeth in there, you can place 2 implants and connect them together like a bridge, but implant supported. The other one is when you have full mouth that don't have any more teeth, you have an options of getting, let's say, on the top 6 implant and put in a fixed one. And then the other one is you can have less, but then a removable with attachment to it. It normally takes 3 to 4 months for the implant to bond to your bone. Dental implants should last at least 9 years or more. It depends on how you take care of it. Dental implant won't get cavities because it doesn't have tooth structures. It's basically metal and crowns. The cost, and it's hard to tell it here because there's a lot of things that we need to consider. If you do need some bone graft or sinus lift, that's another thing. But then there's always a financing available in order for you to avail a dental implant financially. Most insurance, they do not cover dental implants. Only few dental insurance covers it. In order for you to set up an appointment, of course, you have to call the office. Here at our office, you can call at 619-477-0570. And I hope that we answer all your questions. But if you have more questions, please don't hesitate to let us know by calling our office again and set up an appointment, 619-477-0570. We're here to help you.